Hi guys, welcome back to the whole tooth and nothing but the tooth, because sometimes the tooth hurts. And today we're going to be talking about toothache. So guys, stick around because I'm going to give you some tips and some advice about toothaches and what you can do about them. Hi guys, welcome back. I am your favorite dentist and your friendly dentist, Dr. Nadim Ahmed, and you're listening to the whole tooth and nothing but the tooth. And today we're talking about toothaches because sometimes the tooth hurts. And listen, guys, I know, we've all had dental problems, but today specifically we're going to be talking about toothaches. So toothaches can be divided into different categories. In your mouth, of course, there's teeth, there's gums, there's the tongue, there's the hard palate, there's a soft palate. If you don't know what I mean by the palate, it's actually the top roof of your mouth. There's the cheeks, there's taste buds, there's all kinds of things in your mouth. Today I'm going to be talking a little bit about toothache specifically because I notice that when people come in, people always think the tooth is the problem. Sometimes the tooth is the problem, but it's not always the case. So let's divide it down into categories. So when you've got a toothache, you're holding your jaw, sometimes you're swollen, sometimes you're not swollen. These are all very relevant to what the problem is. Sometimes you can see the problem in your mouth. You look in your mouth, you're like, oh God, I got a hole in that tooth. You're standing upside down, you're putting your phone in your mouth, you're trying to analyze the problem, then you're Googling it, you're looking it up, what the problem is. But guys, I'm going to break it down really simply because sometimes when you come to see me as a dentist, I'm going to ask you certain questions. And you're like, what do you mean, doc? It hurt. I said, yeah. How long does it hurt for? Now, that's the main criteria. Let's talk about criteria number one, how long the pain lasts. So you're going to tell me, you know what, doc? It's all the time. I got a toothache right now. I'm talking to you. It's hurting. Okay. That is a serious problem. Sometimes you'll say, well, you know what, doc? Sometimes when I eat cold food, it hurts and then it goes away, but it really hurts. Then you're like me. You know what? If you gave me some ice cream right now and I put it on my teeth, I'd be like, oh, that's killing me. But actually, I don't have a tooth problem. I just got really sensitive teeth. So let's talk about that. Number one criteria, how long the pain lasts. If you apply the stimulus, let's call the stimulus ice cream. Let's call it a sweet, candy, something that has sugar in it. And you put it on your teeth and it lasts 1, 2, 3. And again, when the stimulus is taken off, for instance, you're licking the ice cream or you've got an ice cube in your mouth and it's hurting while it's in your mouth. If you remove that ice cube and then you count 1, 2, 3, okay, it's going away. You don't have a problem. That's not a serious problem. That is just sensitivity. It could be your gums, meaning the roots of your teeth. It could be just you're inherently sensitive. So those types of toothaches per se can be fixed really easily. You could use topical fluoride. Fluoride kind of hardens the tooth structure. Some people don't like fluoride. I tell them, okay, don't use fluoride, use something else. Sometimes you can use things like potassium nitrate. That's a big term, but some toothpastes have potassium nitrate in them. And what that does is it desensitizes your tooth. Now, let's go on to the second category of toothache. You put the stimulus on your tooth, the ice, the sweets, whatever you're doing. And what happens? Oh my God, it's killing me. It's hurting. And you know what? You've taken the stimulus off the tooth. You've cleaned your tooth and it's still hurting. That is a more major problem. What do I mean by that? Now it means that something's happened to the nerve. The nerve is getting sick inside your tooth. Okay. So now you know that the nerve is sick inside your tooth. Now, can you always see the problem? I love it when patients come in because they say to me, I said, sir, how do you know you got a problem? They're like, because I can see it. I said, so how do you figure out the problems that you can't see? And they're like, well, I don't know about those. So it's kind of neat because people always think they've figured out the problem, but the problem may not be the problem that you see. Now, that is why I'm going to talk to you about problem number two. Problem number two is irreversible pulpitis. Do you like that word? I like that word a lot. is called irreversible, which means it can't be reversed. Pulpitis. Pulpitis means inflammation of the pulp. What the heck is the pulp, you're telling me? Okay, the pulp is the middle part of the tooth. That's where the nerves hang out. That's where the nerves are. That's where the blood vessels are. That's where all the sensitive material of your tooth is, in the middle of the tooth. So sometimes what happens is the outside communicates with the inside of the tooth, because there's all these little tubules like pipes that run from the outside of the tooth to the middle of the tooth. And later on, when I'm at the board, remind me, I'm going to show you what I'm talking about, what's in the middle of the tooth, what's in the outside layer, and what's on the outside layer of the tooth. I'm going to tell you all of that. So hey guys, here we are at the board, and here's the depiction of the tooth. This is what the tooth looks like in your mouth. When you have a tooth, the tooth is surrounded by gums. This is a representation of the gums. And then below that is bone, and then below that is blood vessels. So let's talk about toothaches again. Let's try to describe exactly what's happening. Sometimes you've got a cavity forming. In other words, you've got a little hole in your tooth. Bacteria get in there, they form plaque, and the cavity gets bigger and bigger. When it's up here, that is the time to fix your tooth. That's not when you know you don't have a problem. There's nothing happening. It's not hurting. But again, folks, I want to tell you, that's why you got to go to the dentist every 6 months, because you're going to find that little cavity at that time and you're going to fill it. Now there'll be no more problems. But let's say we leave that cavity. Now the bacteria get bigger and bigger and bigger and bigger, and wallop. What happens? They run into the middle of the tooth. That's where all the nerves are, the blood vessels. And that's when you start having a serious toothache. Before that point, you might feel it a little bit. You'll say, oh, I feel it a little bit when I'm eating something hot and cold, but it hasn't got to the nerve. When the bacteria get to the nerve, it is party time. They are loving it. They're getting all in here. They're infecting this. They're infecting the whole root, and they're causing you a really big toothache. And this is when usually it's absolutely killing you. You're telling me it's worse. If you're a lady, you're telling me it's worse than childbirth. If you're a man, you're telling me, I think, oh, that's really bad. And basically what's happening is the nerve is being destroyed. That is irreversible pulpitis. Now, if you let it go after that point, because sometimes people say, hey, doc, it was really hurting there for a while, but you know what happened? The toothache went away. It's because all the nerves are dead inside your tooth. Now it goes into a different stage we call necrosis. Necrosis is worse than irreversible pulpitis because now the nerve's dead. It doesn't hurt. And now guess what? The bacteria are coming out of the end here, and they form these massive holes in your bone. And the pus is just leaking out into your blood vessels. And then people say to me, oh, I need antibiotics. And I said, the bacteria has been going into your blood for months or weeks or days. You can insert whatever timeline you want as to when the problem happened and as to how long the bacteria has been in your blood. Now, when the bacteria gets to your blood, here's what happens. It went from going from a toothache. Now you're telling me, okay, it just hurts when I bite. Doesn't hurt any other time because all of it's dead in there. It's really the worst case scenario. People think it's a good thing not to have pain, but actually the pain was telling you I got a problem. The tooth was like, yay, hey, I've got a problem back here. And then when the nerve died, then it felt better and you were like, oh, thank God that pain went away. But actually you had a more serious problem because now it's all pus in there. This pus, it manifests itself in three ways. One is it could swell up. This pus will go into a space in your face and you get swollen up. You're still a bit more fortunate there because you know something's wrong. So you can fix it. You can drain the pus. You can address the tooth. The second thing it can do, it can go into your mouth. Sometimes people come in, they say, I feel like I'm sucking on a coin all day. You know, that metallic sort of taste. I said, sir, that's pus. You're tasting pus. And they're like, oh, gross. Okay, that is pus. So it drains into your mouth. So 2 places so far. Swelling. Okay, that's one place it's going. The second place going into your mouth. And the third place is it's just going right into your bloodstream. So if you have artificial knees, if you're immunocompromised, if you just want to be healthy and not have bacteria flowing through your veins and your arteries, then this is where it's going, folks. It's going into your blood. So what do we do? I'm going to tell you a quick solution, although I am going to move on to other toothaches. The solution to this is, what do most people say? Hey, yank it out, doc. Yank it out. Actually, you don't need to do that. Just so you know, you don't need to do that. How do you get out of pain? The pain you've got to remove the source of pain. What is the source of pain? It's all this stuff inside your tooth that's destroyed the nerves, that's caused all the pain. You've got to get rid of that bacteria, the pus inside your tooth. So, hey, guess what? You actually made it a little bit easier for me already, because when I go down here and start cleaning this out, firstly, I'm going to get you numb. Listen, don't fret. Even if you have to have what we're going to talk about, which is a root canal, listen, that's a dirty word to most people, but they don't know what they're talking about, because root canals get you out of pain. They don't cause pain. They remove pus and bacteria and bad things in your tooth. They don't put bad things into your tooth. So all you folks who are listening to, I don't know who you're talking to, because we do root canals every day of the week. And thank God we help people go from pain to no pain. So this is how it's done. You get the tooth numb. And for all you people who are doubters, you got to go see a dentist like me who can get you numb. You got to be numb. You're not going to work on the tooth while you're not numb, because it's already hurting. How do you know the tooth's numb? Because you're going to say, it's numb. I don't feel it anymore. Wow. Some people start crying. Some people start sleeping because they're so happy and they've been up all night. So what do? You get the tooth numb. Then what you do is you go into this area right here. You go and clean it all out. Now there's no more source of infection. Nothing going to be putting a hole in your bone. No pus in your blood. No pus to make your jaws real big. It's all gone. So that is what a root canal is. And next I'm going to talk to you about, taking out the tooth. Okay, when you take out the tooth, obviously you've taken out the tooth. The problem with taking out the tooth is you're going to end up spending large amounts of money trying to get the tooth back. The second negative to that is you're going to start losing this bone, because anytime you take out the tooth, the bone starts to shrink, the gums start to shrink, and that's where you see people's faces start to collapse and start to have all kinds of different ramifications, and then they're asking to get the tooth back. And remember, folks, don't do yourself irreversible damage. Don't make the best decision for yourselves. I'm not biased. I will take out your tooth if you tell me to, because it's your tooth. But I always encourage you, if you can, to save the tooth. Next thing, we talked about odontogenic sources of pain. That means from the tooth. Now let's talk about periodontal sources of pain. The gums. Around your teeth there are gums. And you've probably seen people out there. When they talk to you, you'll see that their gums look really angry, they're red, they're inflamed, and literally they bleed all the time. Like I see sometimes folks, and I feel sorry for them, and I try to help them the best I can by educating them, but they say, I don't brush my teeth because my gums bleed. That is periodontal disease. Now, at first it doesn't hurt. It doesn't normally hurt. That's why people don't do anything about it. They just say, okay, I'm not going to brush my teeth, or I'm just going to do something else. I'm going to use mouthwash. Don't do this, folks. I'm going to use hydrogen peroxide. No, the wrong solutions. But what happens is the bacteria now is going this side. They're starting to infect the gums. And what happens is, this is a normal side where the gums are at the normal level. And what happens is, when they're in there long enough, they start destroying the bone and the gums start to recede, because now the periodontal disease causes recession of the gums. But now you have what's called a periodontal abscess, or periodontal disease. It develops into periodontal abscess. That can also cause pain. That can also mimic a toothache. In other words, you do have pain in your gums, it's swollen, but it's limited to the gums, just around the edges of the teeth. That's also a very fixable problem. It's not something where you've got to doom your tooth to, the graveyard. Because again, folks, the reason why I'm emphasizing this, too many of you think that the solution to your problems is not to have teeth. Now, if you've been talking to grandma who has had no teeth for eons and decades, like my grandmothers, they didn't have any teeth. They don't even know what it was like to have teeth. Okay, they're okay with it. But if you're like me, you're getting on in the years, your teeth are more valuable to you. Don't write them off. So what you do is you fix this problem by cleaning up the gums. And again, just as I emphasized, you've got to find somebody who can get you numb. I promise. I raise my right hand. I promise to get you numb. I'm on your side. I will not touch you until you tell me you're numb. The days of, somebody working on you, drilling on you, hurting you while you're not numb, they're gone, folks. At least they're gone in my world. So what you need to do is find somebody who says that to you, and will do it, deliver the goods. So here's what you're going to do. You're going to get rid of that problem. Now you fix the problem. You can be happy that you got rid of the bacteria and the source of the pain, your gums and your bone. It's gone, the source of pain. And guess what? You get to keep your tooth. Now, last thing is non-tooth related toothaches. Let's talk about that a little bit. There's one more category that I want to touch on. For you youngsters out there between the ages of 17 and 21, sometimes all of a sudden you get this toothache way in the back of your mouth, but it only happens when you bite down, and you'd be like, it hurts when I bite down. It hurts when you bite down, and that's because you have a wisdom tooth coming in. And what that does is that the gum on top of the wisdom tooth, there's gum over the, what some people call impacted. Is impacted, which means gum is over the top. There can be bone over the top of the tooth, but it's going to come through the bone and through the gum. And what happens is when that tooth starts breaking through the gum, you are now biting on the gum. The top tooth is biting on the bottom tooth and it hurts. So that's quite easy to remedy. And again, God bless you. Wisdom teeth normally have got to come out. You've got to take them out normally and just get it done. Get it over and done with. The younger you are, the easier it is. The easier you heal, less complications. So what happens is the gum can cause the pain, and it's called periodontitis in a situation where the wisdom teeth are causing the problem. So what you do is you remove the wisdom teeth. Sometimes even those wisdom teeth, they have little openings where it's poking through the gum, and you'll get bacteria under, like your food will accumulate on there, then bacteria get under there, and that's the same type of infection, like a periodontal infection around there. But again, that's easily remedied. Do it early though, folks, don't wait. Last area I want to talk about is non-odontogenic, non-tooth related toothaches. And you're thinking, how the heck do I get a toothache if it's not in my tooth? Okay, I'm going to explain to you really simply. I've had so many patients come in and they say, I swear my top teeth are hurting. Oh my God, it's killing me to bite. It's killing me. Everything's killing me on my top teeth. And they'll talk generally, this whole side. They can't pinpoint to one tooth. Sometimes, folks, it's just sinuses. You've got a sinus infection and all of those back roots. Imagine this is facing downwards. On your upper ones, the roots are actually up in your sinus. So the ends of the roots, sometimes they react to how the sinus is feeling. So if the sinus is filled with sinusitis and it's got fluid in it and you're not feeling good, it affects the teeth. And that is outside of the teeth. Although it's related to your mouth, it's actually coming from another source. Sometimes it can be things like TMJ. TMJ, by the way, is not a disease. All of us have two TMJs. It's called temporomandibular joint. But sometimes those joints, they can have a problem, which is called temporomandibular dysfunction. And what happens is that can radiate pain because all these nerves, they're linked together. So it can cause you pain in your teeth. And again, that's something that you have to come to see me or somebody like me to let you know what the problem is. And we have a certain set of criteria that we follow and diagnostic tools that we have to really isolate the problem. Do not, whatever you do, start taking out your upper back teeth. Folks, I've seen it happen because you'll go to the dentist and you'll tell the dentist, I'm not listening to you. I want my teeth out. And he says, okay, sir, whatever you say. And then they take your teeth out. But you know what? Your problem didn't go away. And then you come to see me and I said, why did you take out all your upper teeth? And you'll say, well, I had a toothache. And I thought, no, see, don't do that. Be objective about it, folks. Do yourself a favor. Do not be emotional. I know it's really hard when you're in pain, but you've got to be objective about it. So when you've got a sinus issue, it can cause a toothache. Your TMJ can cause toothache. Sometimes people have pain related to neuralgia. I've seen patients where they've got something wrong with their nerves in their face and in the trigeminal nerve, in the facial nerve, and it causes pain in their teeth. Now, God bless you, folks. It's a miserable problem to have. But again, we've got to differentiate that from a toothache. Otherwise, you're going to be indiscriminate about losing your teeth. So, folks, I hope that's helped you today. This is what it's all about. Diagnostic tools about getting to the root of the problem. I'm sorry, I had to throw that in. And so, folks, I want you to know that it's actually more simple than you think, but you do need a professional to help you out to determine the source of the problem. so we can fix your toothache. All right, guys, we're back from the board. And you know what? Now you know all about toothaches. You know exactly what to do when you've got a problem, if you've got a serious problem, or whether it's a minor problem. And you know what, guys? You're going to be the most informed patients when you go to see your dentist. And you know what? I got to tell you a little secret. We love patients like you who know what they're talking about, who know what's going on in their mouth. And guys, you know what? I'm going to give you all the secrets, all the little tips so you can help yourself. Go to my links, go to my website, and I'm going to share all the secrets with you about dentistry so that you can help yourself, you can help your family and all your friends. And you know one thing, guys, you got to remember, I like mine waxed.